Today, we're diving into a topic that impacts millions of people worldwide: anxiety. It's something that can creep into our lives quietly or hit like a ton of bricks, leaving us feeling overwhelmed, exhausted, and uncertain. But here's the good news: anxiety doesn't have to control your life. By understanding the symptoms and learning effective management techniques, you can take back control and live a more balanced, peaceful life. So grab a notebook, settle in, and let's break down what anxiety is, how it shows up, and, most importantly, how you can manage it. What is anxiety? First, let's get clear on what anxiety actually is. Anxiety is your body's natural response to stress. It's a feeling of fear or apprehension about what's to come. Think about when you're about to give a presentation or walk into a job interview. That nervousness you feel? That's anxiety in action. It's not inherently bad. In fact, it can keep you alert and focused. But when anxiety becomes constant or overwhelming, it can start to interfere with your daily life. That's when it shifts from being a natural reaction to a condition that needs attention. Common symptoms of anxiety. Anxiety can manifest in different ways for different people, but there are some common symptoms to watch out for. Let's break these down into three categories: physical, emotional, and behavioral. Physical symptoms. Increased heart rate or palpitations. Shortness of breath. Sweating, trembling, or shaking. Muscle tension, especially in the shoulders, neck, or jaw. Stomach issues like nausea, cramping, or indigestion. These symptoms are often tied to your body's fight-or-flight response, a built-in survival mechanism that kicks in when you perceive a threat, even if the threat is just an upcoming deadline or a social event. Emotional symptoms. Constant worry or fear. Feeling on edge or restless. Difficulty concentrating. Irritability or frustration. Behavioral symptoms. Recognizing these symptoms is the first step in managing anxiety. Awareness empowers you to take action. Understanding the causes of anxiety. Anxiety can be triggered by a mix of factors. For some, it's rooted in genetics, a family history of anxiety disorders. For others, it may stem from environmental stressors like work pressure, personal relationships, or financial struggles. Certain medical conditions and even lifestyle factors like caffeine or lack of sleep can also play a role. The key takeaway: anxiety is not your fault. It's a combination of biology, environment, and behavior, and understanding this can help reduce the stigma around it. Techniques to manage anxiety symptoms. Now let's talk about solutions. Managing anxiety isn't about eliminating it entirely, it's about learning to handle it effectively. Here are some proven techniques. Deep breathing exercises. One of the quickest ways to calm anxiety is through your breath. Try this: inhale deeply through your nose for 4 counts, hold your breath for 4 counts, and exhale slowly through your mouth for 6 counts. Repeat this cycle several times. This simple technique can help activate your parasympathetic nervous system, which counteracts your body's stress response. Grounding techniques. Grounding exercises can bring you back to the present moment when anxiety feels overwhelming. Identify 5 things you can see. 4 things you can touch. 3 things you can hear. 2 things you can smell. 1 thing you can taste. This helps redirect your focus away from anxious thoughts and back to your immediate surroundings. Journaling. Writing down your thoughts and feelings can be incredibly therapeutic. It helps you process what's going on in your mind and identify patterns or triggers. Try setting aside a few minutes each day to write about what's worrying you and how you're feeling. Physical activity. Exercise is one of the best natural stress relievers. Even a 20-minute walk can release endorphins, reduce cortisol levels, and improve your mood. Whether it's yoga, running, or dancing, find an activity you enjoy and make it a regular part of your routine. Healthy lifestyle choices. Sleep. Aim for 7 to 9 hours of quality sleep each night. Nutrition. Avoid excessive caffeine and sugar, which can exacerbate anxiety. Focus on a balanced diet rich in whole foods. Hydration. Staying hydrated supports your body's ability to handle stress. Cognitive behavioral therapy, CBT. CBT is a widely used therapeutic approach that helps you challenge and change negative thought patterns.